Again, let me start again. So my name is Marc Capogrossi, and it's great to be here in Miami, Florida, presenting a brand new carrier for you guys here in Florida, also in Texas and in Maryland. So that's kind of what I'm going to go over today. I'm going to try to make this a little fun, try to keep it interactive. There'll be about 3 things I'm going to ask you guys to write down. Those things are going to be for you guys, of all the information you guys take away, it's going to be places for you to go in terms of broker sites, material, and so forth. So if I mentioned it, that's what it is. This is my 4th one today, so I'm not really sure what's going to come out of my mouth next. So again, I appreciate it. It's very exciting, though, to come down here and introduce a new carrier. So first thing we'll talk about is Wellpoint. Who is Wellpoint? Also, as you go through and start offering these plans to your clientele, what tools are they going to have available to them? Also, what tools are going to be available to you as brokers, resources? We're going to go through some of the products, the service areas, a little bit of the network information that I was able to share, broker support, and also just kind of have a discussion. I like discussions. It means that y'all are listening. It means that y'all have questions. If you have a question, it may relate to someone over here. So let's ask those questions and kind of have this kind of like a town hall type open discussion meeting. Does that sound fair? Yeah. All right. So let's talk about Wellpoint. So Wellpoint seems to be new, but we're actually part of a very large corporation. We're part of the Elevance Health umbrella. Elevance Health is top 25 Fortune 500 company. And under Elevance Health, we have a lot of different companies like Carelon, which is a PBM, Wellpoint. Y'all are familiar with Simply, which is a Medicare product down here. Amerigroup. There's probably some that I missed, Unicare. Also, probably one of the more popular ones is the Anthem brand, which we operate the Anthem Blues in 14 states as an ACA. So when I tell you guys it's exciting for me to be here in Miami, it is, because I've been in 14 states for the last 15 years, so it's nice to be outside of my comfort zone here in South Florida. In Florida, we're going to be expanding into those areas under the Wellpoint brand. So yes, we're new, but financially we're super strong. We know the ACA. We know ACA. We've been a part of the ACA since day one. So when people see us as a new company and they want to compare us to some of the other ones that have come to Florida and have failed, it's not a comparison. Not a comparison. And so we're going to talk about a little bit about that, and any questions, feel free to ask. But I think it's important as a new company to let people know our strength, our financial strength, our ability to build networks, because we already have contacts with a lot of those hospitals, providers in the area. And we're continuing to reach out and trying to get those guys contracted. As I mentioned, we are expanding into 3 states under the Wellpoint brand. We're not in the whole state of Texas. We're not in the whole state of Florida, but we'll get there. We'll get there. So it's important as you sell and offer a Wellpoint product to your client, the last thing you want to do is have to walk them through a bunch of stuff. You want them to be able to kind of self-service themselves a little bit. So a couple things that we have there is our member portal at wellpoint.com. Members, if you offer a product, they have questions about it, they want to go out and do some additional research themselves, wellpoint.com. See, this thing just goes crazy. Wellpoint.com. If and when they become a member, wellpoint.com, they can pull their ID cards. They can manage their whole health insurance product themselves by managing claims. Sorry for standing in your way. View ID cards, search for doctors, pharmacists, medications, all of that is out there. I know a lot of you guys are probably using Sherpa as their quoting platform. I'm sure there's some others out there. But you can go in there and put your doctors and medications, it lets you know. Sometimes that doesn't work. Or if your member wants to go out there, they can go in there and find care at wellpoint.com. You can search with a member ID or as a guest. And the good thing is when you're in Florida or one of these states, it's all the same network. So you don't have to dig around and look for the correct network. It makes it a little bit easier. But I would encourage, if this is something to write down, is our Sydney app. This one's, why do I say to write this down? It's because what's the first question you get after you enroll somebody? Where's my ID card? Well, the Sydney app gives them access to their ID cards. Also, everything that was in that member portal is right there with their smartphone. Their Apple, their, what's that other one? The Android. Thank you. Sorry. Did you see my head just go blank? It's kind of embarrassing. But yeah, they can download that and have access to everything they need right there on their phone. If they go to a provider and the provider says, hey, I need a copy of it, that's fine. You can sit there and email it to them right there while they're standing there. So a lot of great access, making payments, order prescriptions, view health records. I'll also talk about some of the incentives that we have on our plans. They can access those all right there from their Sydney app. I love it. Your members will love it. And if they have access to all this, that means that they're not calling you. You're calling somebody else and making more sales. 4.8 stars. Over almost 16 million people have this and manage it. I'm one of them. I love it. My wife says, here, take the ID card. I have an app for that. But it's a really nice app. Also, with the Sydney app, you can access virtual care. A lot of these on the ACA side, this virtual care is no cost to your members and to your clientele. You can also see members can also have virtual visits with a licensed therapist for stress, anxiety, depression, family issues, or other concerns. As we go through open enrollment as agents, if you buy our product and you have family issues, you can also talk to somebody. That was a bad joke, wasn't it? It meant y'all were working hard. Anyways.
Half stress, I know.
Okay, that was like, it's too stressful to even laugh right now. But yeah, in all seriousness, the mental health is a serious thing out there. And so being able to have people to have access to it at home, work, in between, whatever, it's just their comfort area may be different than yours or mine or whoever. They can do it from the comfort, ease of their phone. The other thing I would also say with the virtual is thinking about parents that have to go pick up their kids from school or daycare, or someone that may not have transportation at all will still be able to access it through their computer, through their phone, library, whatnot. It seems like everybody nowadays has some sort of smartphone or smart device. You have a question?
No.
No.
You can
So,
also have it in Spanish.
it is also in Spanish.
What are the languages? Do you have Russian?
I don't. Maybe I can't read it. I don't. I know. I don't think so, but I don't know.
But you do have Spanish.
We do have Spanish. Yes. Yeah. See, I'm trying to make it a little fun. Can you edit this? All right. So I also talk about the Sydney app. I also talk about our incentives. I do know that there are other carriers out there that have bigger incentives out there. But as you're going through a sales process with a client, sometimes you may have some dead time where it's just quiet on the phone or in front of them. Encourage to talk about the Sydney app and encourage people to go get their wellness exam. They get $50 if they go get it done within the first 90 days. They get an additional $25 if they go out and fill out a health assessment. Those are available through the Sydney app as well. It's not a lot of money, but how long did it take me to explain it? Enough for that app to get processed and you can move on to the next thing.
You say 50 and 25?
Yes, 50 and 25, and I have it on another slide. Yeah, but that's available, accessing it through the Sydney app. That's where. So what about the broker tools? You have a question?
Yes, I have a question. That gift card can be used for pay the premium payments or for health purposes, appointments, or?
I think they're going to be more cash gift cards, but if they get the gift card, and if it's like a Visa card like that, if they want to use it, I don't think one of that would be a. It's like an e-card. Yeah.
They can use it whatever.
I think they can do it wherever they would like to.
Whatever payment.
Yep. So the next question is, what are my tools as brokers and agents? Nothing more frustrating in selling a product and not being able to service your client, find their ID cards. Wellpoint.com, that is where your broker toolbox is located. You can go on there and manage your clientele. You can access ID cards. You can actually pull late reports. You can also, as your book of business grows, you will be able to pull reports of people that are turning 26, aging off their parents' plan, aging off of the individual into the Medicare. Those reports will give that to you. Also, if depending on the size of your agency or whatnot, you can set delegates. So, meaning if you have someone in your office that's just an admin, for example, and you want them to have access to ID cards only, or certain things, you don't want them seeing commission statements. You can set, you can set the delegate any way you want, and you can go through it and pick them. Man, I have a complaint. I don't even need to say anymore. But yeah, so on the wellpoint.com, make sure you go out there and register. Once you register and you become a member, a selling agent, you'll be able to manage all that stuff for yourself. All right, next, this one. This is the other thing I'd ask you to write down. The wellpointbrokerhub.com. Why is that? Because everything you see in front of you is out here on the Wellpoint broker site. You're going to see the maps. I printed those because I thought I needed to. The sales material, everything is out there for you to review, to download, email. It's both in English and Spanish. No Russian. Just messing. That's horrible. But yeah, they're out there. You can pick the different states. I'd say go out there, take a look at it. There's a lot of great information. Just because there's something not there today, check it again. Check it again, because as we get closer to open enrollment, you may start seeing more and more data and information out there for you. More marketing flyers, etc., for you to be able to access. So the Sydney app, wellpoint.com, and the Wellpoint Broker Hub. You got all those written down? Yep. All right, y'all can leave now. So like I said, there's a lot of the material out there that you guys can go out there and see. And like I said, English and Spanish only. When it comes to the product lines for 25, I think it's important to understand how in our naming of the plans. I'm sure a lot of different carriers do it similar, but as a new one, I wanted to make sure. We include our network name, which is going to be Wellpoint Florida Essential, Wellpoint Texas, whatever. But that's going to be your network name. Your metallic level will be next. You can see down here POS. Well, in Texas, we do offer a point of service plan. But if you don't see anything, it's going to be an HMO. We do have adult dental and vision built into some of the plans. If you don't see it in there, like this one down here, it means it's not embedded. I went over the virtual PCP. I didn't say anything about select drugs because that's pretty easy. We do offer a lot of most commonly used prescriptions at no cost, and of course the incentives. So when anybody says, oh, why are you doing all this? Well, it's a part of each plan name, which means that your client's going to look at it and go, what is this? What is that? And I want to make sure you guys will be able to answer it. For some of your cost share reduction plans, you can see there at the end the S06. As you're going into Sherpa, for example, you're playing around with people's incomes. You know, they don't know how much they make. They're here, there, whatnot. The S06 is going to be your very high 94% actuarial value plan, which means that you're going to have the $0 copays for primary care, very small copay for specialists, low deductible, if any. But then S05, S04, you'll see that there as depending on their income and what cost share plan that they qualify for.
Are they all, so you said that if it doesn't say anything, just automatically think it's an HMO. Do you have any?
Do I have any what?
PPO.
What's a PPO? I'm kidding. No, ma'am. It's going to, and I'll go through each state, but yes, most of them will be HMOs. We do have a point of service plan in Texas, but no PPOs. So first we're going to talk about Texas. So the big ones really is in Texas. We do offer HMO. We'd offer, I'm sorry, I can't see it either. We offer a HMO as well as a point of service plan. That POS is an in-state benefit, like in-state, in-network, out-of-state. I mean, in-state, in and out-of-network, in-state only. If they're out-of-state, it's got to be deemed as an emergency. And that's all plans. That's all plans. But that in-network, out-of-network for that POS is in-state only. Want to make sure that's clear. We do have some embedded adult dental vision plans as well as a pediatric vision plan, and we're in 24 counties. HMO POS, on and off exchange, bronze, silver, gold. It is an open access. No referral required, no gatekeeper. We do ask you to put a mandatory PCP though. Not a big deal. If you don't put it in there, we'll assign one. They want to change it later, that's fine. That's easy, no big deal. The best part is, if they need to go see a specialist, they go to see a specialist without the primary care interfering.
Is that only for Texas, not Florida?
It's for Texas, Florida, and Maryland.
Oh.
Yep. This slide's going to look almost very similar. We do offer standardized plans. You'll see the word standard in those plans. They'll probably look similar to all the other carriers. We also offer some non-standard plans. As I mentioned before, Wellpoint, Texas Essential, that's the network. That's going to be in the plan name. I don't really talk much about the pharmacy networks because I've never in 15 years had anybody come to me and say, my customer can't find a place to pick up medications. So, pretty easy there. The virtual PCP, Zero Select, which is the most commonly used medications, they're all going to be at no cost. This one here in this state of Texas does have embedded pediatric vision. We don't offer any standalone dental or vision plans at all. And there's the incentives down there, that $50 for a wellness exam, $25 for the assessment. I know other carriers have much more, but it's a free, easy way to get $75. All right, there's the, sorry. So I talked about 24 counties in 24 counties there in Texas. You can also, someone's going through slides faster than I am. You also see in those you can see these major cities like Houston, Dallas, Austin, El Paso, Lubbock, and San Antonio. Those maps are there in front of you, just to kind of get an idea of the footprint. Again, that's at wellpointbrokerhub.com. It does not require a password or a username. Anybody can access it. We're not hiding anything from anybody. These are some of the hospital systems. This is not all the hospital systems. This is the ones that I was able to get and extract out of our networking team. They were kind of holding it close to their chest, but they said, don't share it. Just kidding. They didn't. They actually said not share it. But I felt like if I was going to come down here and present, I needed to add some meat to the bone. And I do think that our networks there in Texas are doing pretty good. Again, we have Wellpoint. We have contacts. We're doing what we can to get them contracted. This is not all of them. This is the ones that I could get from our network team. Yes, ma'am?
So you do believe that El Paso will have more than just the one hospital?
I don't know. I would have to go out there and check just to make sure. But, you know, with El Paso just kind of out there, I don't know. Is there more than one hospital in that county?
Yeah, there's Providence, Del Sol, Bliss, Tennant, and
Okay.
Baltimore.
Are those more regional or major hospital systems? Okay. I don't know. I'm learning as I go along. And, you know, if you go to wellpoint.com, those networks are already there for you guys to kind of start playing around and start looking. But, you know, I wanted to bring something. And I do think our networks are doing, at least starting out, pretty good. And I do think that they'll continue to expand. So again, I'm not going to go I'm not doing it at all. I'm not going to go through that. I'm going to bore y'all if I start going line by item, but you guys know how to read benefits. More importantly, you know where to find them now. The broker hub, right? See? Oh, crap. But you'll see some of these plans will have the word standard in it. That's that standardized plan. They all have the $0 virtual, PCP, zero drugs, incentives. Again, that's why I mention them over and over again. You'll see the point of service plans. You'll also see HMOs. All right, we have someone that's happy. Florida. So in Florida, there's no POS. It's just an HMO. We do have plans with adult dental and vision, and we have the pediatric vision embedded in those. And we're in 24 counties there. I'm sorry. Okay. You'll see the HMO on and off exchange, bronze, silver, gold, as well as catastrophic. They are open access plans. There's no gatekeeper. Mandatory PCP. Again, if they don't select one, no big deal. They can do it later. And the big one here, well, I think we kind of talked about that already with the adult vision and the pediatric. This one had the pediatric vision built into it. There are the 24 counties. A lot of the major cities like Fort Lauderdale, Miami, Orlando, Palm Beach, Tampa. Florida's got a lot of major cities, highly populated, a lot of people down here. You can see that on the map there that we're covering a good portion of Florida. There's the meat. No pictures, please. I'm kidding. So this is some of the network stuff. Again, this is not all of it. I just want to make sure that I at least brought something down here to share with you guys in terms of the network. I've heard a lot of good things about the network, or at least the major hospitals, either major and or regional hospital systems that we have so far. But I think that will continue to expand in terms of more PCPs, more specialists. All that's continuing to grow. What do y'all think? Yeah,
You guys have a lot of doctors, a lot of providers, that's like the main.
I think we have one.
They speak Russian though, right?
No.
Oh.
No. No, we do. We do have a lot of doctors, primary care specialists. You know, CMS does require us to have certain adequacies to make sure we have enough providers that cover everything in each of the counties. And like I said, you know, every day our networking team is still working on contracting. I'm sure that this is not necessarily outdated, but I'm sure there's others that we can add to it. But it's one of those things that's going to be an ongoing process as we keep adding people. And I'm sure they've been working on this for the last couple of years. Like I said, I just wanted to bring something. And from some of the partners we spoke to, they were like, "Oh, that's a really good start." Then they ask, "What's the commission and what's the rates look like?" These are questions I don't know. But again, a lot of the plan designs are out on the broker hub, Wellpoint broker hub, so you can go out there and look at them. They're all HMOs. Some have specialist copays. Some have deductible co-insurance.
Can you provide the drug list?
I'm sorry?
Can you provide the drug list?
Do I have the drug list? I don't have it. I'm sure it's out on the wellpoint.com. Yes, sir. And I do think that Sherpa does, it includes it too on Sherpa. So they'll be out there as soon as that window shopping opens up. Anybody sell in Maryland? No Maryland. All right. Well, because it's being recorded, I have to say it. So in Maryland, we are statewide. That's why there is not a map here. So we're in the entire state of Maryland. We're offering the HMO plans with zero virtual PCPs. We also have embedded pediatric dental and vision in the state of Maryland, unlike the other states where it's either pediatric vision in most cases. HMO, both on and off exchange in Maryland. Same metallic, bronze, silver, gold, catastrophic. No gatekeepers, open access product, but does require mandatory PCP. All right, damn it. Someone in another room is just as angry and frustrated as I am. So I'm glad y'all are laughing. But again, you can see some of the plans. This is all out there for you guys to kind of take a look at. One of the things we kept mentioning is on and off exchange products. You know, you guys are using a third-party EDE like Sherpa or healthcare.gov to enroll on exchange. Our off exchange plans are going to be available at the wellpoint.com in your broker hub. So if you have someone that just totally does not want anything to do with the marketplace, they want an off exchange product, you can do that at wellpoint.com, logging into your broker portal. Pretty easy to go in there and run a quote. You'll also see some marketing. Yes, ma'am?
Sorry, question. So I know with a couple carriers, if you do Medicare and ACA, it has to be the same upline. Can it be separate uplines or be direct for your guys' ACA?
Let me hit that. I'll hit that for you. No, you're good. That's a good question. So we do some marketing campaigns that you'll see in every market. This is just a brand awareness type thing, letting people know that if you're in the ACA market, you're going to have another choice, which I think everybody likes. So to kind of answer your question about broker hotline, so yes, at Elevance Health, we give you a lot of opportunities to edit your appointment and also have different uplines. Because Wellpoint, we're new to this state, as well as in Texas and Maryland, we are requiring everybody to get appointed under a preferred partner. That preferred partner may be different than your upline today. That's fine. That is fine. You can sell your Medicare plans under this upline and your ACA under this one. And you can almost vary depending on state too. It's really cool. If you get into the broker hub, go to account details, you're not going to remember all that. But you can go in there and edit your appointment once you get it, and you want to change it from this upline to the next, it's fine. As long as it's not an true FMO with us, then you may have some difficulties altering that because you do need a release. But wellpoint.com, there is the broker support number. We do have a broker support office in Kentucky as well as in California. That means we have all time zones covered. And I would assume in open enrollment, we'll have extended hours, which will be helpful, as well as weekends. And if you are real late and you just want to email it, that's there for you as well.
Do you have the phone number for member services?
I do. I don't know it off the top of my head.
Do you have it?
Huh?
Where do you have it?
It's on my Sydney app. So,
That's a good place to have
yeah.
it.
I'll get it to you. Any other questions? Oh. So I always tell people when it comes to the commission side of it, we're going to keep those to ourselves for a little while until we start seeing what the market does. If the market starts to bring commissions down, well, we'll probably follow it. But if commissions start to go up, then we need to adjust our commissions to make sure that it's a fair compensation. We do look at the PM for each carrier to make sure that we're kind of in the middle, upper middle. Florida is around 30 for the high, 25 is kind of the norm. What's that? Is that about right? So I think that we'll be somewhere in that norm. If the market shifts or goes up, well, we want to follow it. So that's why I don't want to sit here and say, oh, we're going to pay this. Because if it changes, I don't want y'all to say, oh, well, that guy told me this. And that's what.
You'll be able to email us.
Yes, our preferred partner is going to, let you know what the commissions are, and et cetera. Yes.
How are the premiums? If the premiums are, with the market share, they're competitive, are you ready for volume?
So I would say yes, we're ready for volume. Being a part of that Elevance Health umbrella, yes. I don't think we'd be coming into this market if we weren't prepared for what's coming. We also, we do a lot of smart people at that company that are looking at it, analyzing the market, understanding what our estimated market share will be, and then looking at all the systems behind it to make sure that they are be able to handle it. Yeah. No, good question. And we have the broker tools and everything in place for you already to help you support yourself and your clientele. Uh-oh. What? Did you want a picture? Oh. I like to end it here. So frustrating. Well, thank you guys. Hopefully that was a little entertaining for considering it's insurance, right?